Hi, folks. Thank you for joining. We're going to get started in just a moment. It's the top of the hour, and we want to give people a chance to get settled in. Welcome. All right, I've got the whole team here, and we're ready to go. So let's get started, and we'll introduce ourselves. My name is Mary Casper. I'm a speech language pathologist, and I'm one of the folks here that is hosting our town hall meeting today on the International Dysphagia Diet Standardization Initiative for the United States and Territories Itsy reference group. So I want to welcome everybody and thank you for joining us. Next slide, Peter. All right, so a little bit of housekeeping. You should have a Q&A box down at the bottom or up at the top of your screen, depending on how you have your Zoom meeting set up. And we will be giving some answers to some pre-populated questions that have come in over the sign-up period of time. But also, if you have additional questions, we would welcome you to submit those into the Q&A. I think only the panelists and the team are going to have the ability to chat. So your questions and answers should come in the form of signing into that Q&A box. Next slide, Peter. All right, so one of the things we're going to talk about today is why Itsy? Why do we need to think about standardized terminology for dysphagia diets? And bottom line is patient safety. Well, we're showing you here that choking incidents occur across all ages, across all sites of care, and around the world. Next slide. There are benefits of standardized systems that include things like safety, clinical efficiency, consistency across commercial products, and the fact that a standardized system is going to be facilitative for clinical research. Next slide, Peter. So we would assert that Itsy promotes safety through common terminology for all ages, across all care settings, and all cultures. And we've had the global implementation of Itsy for a number of years now. We had a kickoff in the United States in May of 2019, and we've now developed the United States and Territories Implementation Resource Group, where we want to improve your awareness, we want to prepare you, and we want to ultimately reach the point of adoption of the Itsy standardization initiative in all care settings across all age groups throughout the United States and Territories. So some information about our reference group structure. We have Itsy Global, Itsy International, and each of the countries or areas of the world that are represented are developing or have already developed resource groups, implementation resource groups. And so we're the United States and Territories Implementation Resource Group. And our group is made up of subcommittees that include implementation advocacy, best practices, resource collection and development, education and training, research and data collection, as well as newsletter and communications. So our panel today is made up of the group of subcommittee facilitators. And you can see that we are made up of representatives from speech language pathology community, dietitians, food service directors, as well as industry leaders in dysphagia management. So I'll remind you again, if you have a question at any time during our time together here today, please submit that to the Q&A box. I'll also direct you to the website, IDDSI.org is fully searchable. And even though all of us that are here today as panelists are volunteers, we really do have a passion for the work that we're trying to accomplish in the United States and territories. And we want to make sure that we are able to support you and get your questions answered. And I think you're seeing in the chat, IDDSI.org is the website that we want to direct you to. And eventually you're going to be seeing things under the United States flag that are going to be populated specific to the United States and territories. All right, next. All right, so I'm going to turn it over to John to get us started on our first question, which is, can you explain the main goals behind the transition from the National Dysphagia Diet to Itsy, and also the current goals for Itsy Global? John?
Thanks, Mary. Probably the simplest way to look at this is the main goal of transitioning from NDD to Itsy is twofold. First of all, Itsy's main driver has always been about patient safety across all cultures and in all care settings. And that's the goal of Itsy is, and that's what it's been done really, really well. And if you look back at the National Dysphagia Diet itself, one of the things it says in there is that it fully expected that, and this is in regard to viscosity, because they didn't find good consensus as to what the viscosity ranges should be for thickened liquids. They suggested we start collecting data, and that at some point in the future, better data would emerge, and then it was fully expected that the suggested ranges here will be modified as soon as more research is available on the topic. So now you go forward about 20 years, and Itsy has come along, and they have a new way of measuring thickness, and we're just sort of evolving from the National Dysphagia Diet and evolving into Itsy. So that's kind of the simplest way to look at it from an overall perspective. And now I'm going to ask Nikki from the A&D to comment a little bit on the perspective of A&D and switching from NDD to Itsy.
Yes, thanks, John, and thanks everybody for joining. I'm happy to be here to speak to the Academy's full support of Itsy. We have been working very closely with ASHA, ANFP, and Itsy Global over the past several years to kind of work towards our overall goal of total United States implementation of Itsy. And as John said, the main reasons being we need to ensure safety of our patients and that we're all following current standards of practice. In speaking to the NDD, as you may know, the Academy did recently come out with the announcement that we will be fully transitioning our nutrition care manual, diet manual, to only reflect Itsy as of October of this year. So we're very happy to, throw all of our weight behind Itsy. It's very important, and I just wanted to let you know that we're committed to updating our nutrition care manual, diet manual to reflect all of the most current Itsy information that's released from Itsy Global. So Academy is extremely excited to be supportive of this initiative. And I'll now kick it over to Rebecca to speak to ASHA's support.
Thank you very much. I will echo Nikki's comments that I'm very happy to be here in full support of Itsy on behalf of ASHA, the American Speech Language and Hearing Association. I really, we have members who work across the continuum of care and see patients from, acute care trauma hospitals all the way through to skilled nursing facilities and home care, home health, and hospice care. And for those reasons, we are fully supportive of Itsy to promote patient safety and better communication and best practice for our members. I'm going to go ahead and put a link in the chat of that will be for ASHA's Itsy page that talks about the history of ASHA's support of Itsy. And there is a bi-weekly newsletter called ASHA Now that you can sign up for, where any news related to ASHA's involvement with Itsy will be shared. So again, happy to be here, and thanks for having me. I think I now will kick it off over to Vicky.
Vicky, you're muted.
Oh, sorry about that. My name is Vicky Bergquist, and I'm a dietitian, and I work for the state of Wisconsin regulatory agency, the Division of Quality Assurance. And what I want to talk about today is the role of the surveyor. But prior to that, I want to talk about whether or not there's been questions whether this is a mandatory a mandatory standard that has to be accepted. And so one of the things I want to clarify is that regulation does not mandate standards of practice, but they do require that standards of practices are used, and that these standards must be current, nationally recognized, evidence-based, and supported by the experts in their field of professional experience and training. And so with that being said, what's unique with Itsy is it's going to be the only professional standard of practice for dysphagia diets. And like Nikki said, the NDD is going away, and Itsy is going to be the professional standard of practice. And again, it's a global initiative based on safety. Now, what are the surveyors going to do with Itsy, and what is their role? Well, the surveyors they have protocols that they have to follow. There's specific protocols for nursing homes, and there's protocols for hospitals. And one of the things they do is go in and fulfill the tasks that they're required to do. And the task is not to go in and say, oh, hey, do you have Itsy? Is this implemented? How Itsy could be triggered for further investigation is if they see that there's a concern about the diet that the patient or the resident is receiving, and that can open up an investigation to look further as far as where are you as a facility, healthcare facility, where are you at with the International Dysphagia Diet? And so that again, we wouldn't go in and I am talking for Wisconsin, but regulations are federal, and none of them say, we're going to go in and specifically look for Itsy. So I hope that clarifies any questions you might have regarding that. So, and with that,
Back to me, Vicky.
there you go. Sorry.
Okay.
Boy, I'm on a roll here.
Thanks to everybody for answering that question. I think we're ready for question number 2, which is, how is the focus of the USTIRG different than that of Itsy Global? And so I'm going to be the one to start off and answer that. So again, if you didn't hear me before, my name is Mary Casper, and I'm a speech language pathologist. And I work for a national organization that has skilled nursing facilities, acute care, home health, hospice, and other avenues of healthcare provision. So the focus of the USTIRG is different than Itsy Global in a couple of different aspects. First of all, there are some great resources on the Itsy.org website. For example, there are patient education handouts. And those patient education handouts are very useful, except that they're written in the Queen's English or British terminology, where we refer to things like crisps or dry biscuits, etc. And so one of the things that was really emphasized to me when getting involved in my role here in this resource group was that we need to be sourcing things that are unique to the United States and territories. So we might take that resource from the Itsy webpage and update it so that it's consistent with what we might be used to seeing in the United States and territories. There also are some provider types that are unique to the United States. For example, skilled nursing facilities and the survey process that Vicky just referenced in her previous answer are really unique to the United States. There's no other country that experiences the federal survey process that's mandated by the federal government, such as we have in skilled nursing facilities. And so one of the implementation challenges is getting it right so that it is consistent with the standards of practice and it is aligned with the expectations that our guidance from the federal government would have for us. So a little more on this question. I'm going to turn it over to John to give us a little further answer.
Thanks, Mary. My name's John Holohan. I'm the president of SimplyThick. And, you know, another consideration here between the differences between what Global's doing and what we're trying to do here is really about, it can even come down to regional issues. And across this broad country, there's a lot of different subsets and groups, and being aware of the cultural differences that we find even across the US. Whether you're talking in broad strokes about regions, the South versus the North or East versus West, or even if it's different migrant communities or things like that that you will find just within the US. And Itsy Global necessarily has to be focused on providing a framework that works everywhere. And so part of what USTIRG is looking to do is to make sure that we address those things, you know, whether it's the simple language issues that Mary just mentioned, or whether it's something very, very specific to your area, or, you know, a very regional food. How are you going to get that and have it comply with the standards, the descriptive standards that Itsy provides? So that's really kind of the difference, is making sure that we take the broad scope of what Itsy is and how do we apply it to, you know, even a very micro, small little area of the United States.
Thank you, John. All right. Question 3 is next. And that question is, how can SLPs, dietitians, and other healthcare providers connect with others implementing Itsy? And I'm going to turn that over to Laura to answer.
Thank you, Mary. Peter, I'm about to share my screen if you don't mind.
Laura, you want to introduce yourself while you're doing that?
Oh, yes, thank you. I am Laura Brooks. I'm a pediatric SLP, and I work at Children's Healthcare of Atlanta, and I am one of the co-leads for the communications newsletter group. And thank you for letting me share my screen. This is the new updated, new and improved Itsy website. So this is the homepage. If you haven't checked it out in a while, there's been a lot of changes. So definitely do that, especially the frequently asked questions tab. That is a nice way to get some questions that a lot of you are probably asking answered, because that's been updated and it's really, really helpful. But for communicating globally with the Itsy, the other Itsy teams, you can click on the news tab, and then the newsletter eBite is here. And we've had only 3 monthly updates to date. So January, February, and March, where different reference groups across the world will kind of highlight what they've been doing. So USTIRG, all of us, we have been updated in a couple of these eBites. So you can click on the latest and scroll down, and it'll tell you about different events going on. what's going on globally, what's going on. This is ours right here, what's going on in the USTIRG. So that's my part of the answer. And then I will turn it over to Katrina to discuss some social media stuff we're doing.
Hi all, thanks so much for joining us. I'm Katrina. I am an SLP. I specialize in fees and work mostly in skilled nursing facilities. And my part with the USTIRG is working alongside Laura and Alla with communications and newsletters. So we hope that you'll sign up for that Itsy e-bite, but in the meantime, you can absolutely find us on YouTube. There are some excellent videos out there, as well as some previous webinars. And we have LinkedIn now, all about Itsy, as well as Twitter. And don't miss our Instagram. And please, if you are a facility that is implementing Itsy, I would love nothing more than to have you send us a DM so that we could get your little pictures and some of your success stories posted right on our Instagram. So please get in touch with us. We'd love to hear more about what you're all doing.
All right. Thank you, Laura and Katrina. We're going to go back to the slide presentation with Peter. And we're on question number 4. So that question is, what are the different USTIRG work groups and how can I contact them? So I'm going to turn that over to Alla.
Hi everybody, I'm Alla. I am also an SLP working alongside Laura and Katrina as part of the communications and newsletter work group. I work at an acute care hospital in Brooklyn, New York. And Peter, if you wouldn't mind actually just popping back up to the one of the initial slides, I'll just reiterate what Mary had said earlier, because I think it shows the different work groups very nicely there. Right, so we have 6 wonderful work groups, all made up of amazing, hardworking volunteers who are the panelists today. So we have implementation and advocacy, best practice, resource collection and development, education and training, resource and data collection, and then our group, the newsletter and communication work group. So if you actually just go to that e-bite that Laura showed you on the Itsy website, on March's e-bite, and you can sign up for those e-bites and get monthly updates. There's a button on that web page, but if you go to the March e-bite, you can email each of these work groups if you have any questions or anything that you want to discuss through that e-bite. Thank you.
All right. Jumping forward then, Peter, we're on question number 5. There we go. Since Itsy only launched in the US and territories in 2019, how much research has been done using this tool? And where can I access current and future research? So I'm gonna send that one over to Jacqueline.
Hi, everybody. My name is Jacqueline Santacross. I'm a SLP. I work in acute care in Southwestern Connecticut. And I am one of the co-leads of the research and data collection group. And so there's quite a bit of research out there that uses Itsy. What our group has done so far is kind of a very broad search for all the different research out there that either mentions, directly researches, or uses Itsy within their research. And so actually quite a bit has been done. We were able to find over 375 different resources, which range from peer-reviewed journal articles to guidelines and statements being put forth by different organizations. And I took a quick look, and actually almost 275 of those have come since 2019 or later. So there's a lot of great research utilizing Itsy in particular. Dr. Katrina Steele is one researcher in particular who has used Itsy levels. For example, she put out research recently that put out normal reference values for swallowing using Itsy based liquid terminology. Right now, in terms of where you can find current and future research, so on the main Itsy website, they have a button that gets you to resources and then to publications, which links you to a couple of the systematic reviews and kind of basic research that went into developing Itsy. One of the goals of our group is to eventually develop a catalog that we will put forth to the public and to researchers to have them access the different research studies that are out there. Right now, our catalog is a little too broad to and not finessed enough to put out there to the public.
All right, thank you, Jacqueline. And then question 6 is more specifically, can you discuss the research on bread and choking? So I'm gonna send that right back to you, Jacqueline. Thanks.
No problem. Yep. So a lot of the questions we get is the restrictions of bread in the Itsy diets and where that comes from. And a lot of the initial research that went into developing Itsy in an evidence-based way looked at choking deaths. And a lot of them were done using autopsy reports. And what was found is that choking deaths are frequently caused by bread products. And so that led to kind of the close look at where bread would need to be eliminated from these different dysphagia diets. Again, you can go to the Itsy website for this one. If you go to the FAQs section, specifically about foods, there's kind of subgroupings. It will bring you down, there's a question specifically addressing this, and it has about 9 resources that you can access. And Karen has put them in the chat right now with some of the resources, including a YouTube video that talks specifically about bread for you guys to find out more information about that.
All right, thank you. Karen, are you gonna make some comments or just have them posted in the chat?
There we go. I was typing wildly there in the chat. As you see, I'm putting them in there. And I'm going to put the 2 foundational pieces of literature from Steele and Chichiro et al. From 2013 and 14. And within those, they do also talk about safety and choking risk and everything. So I'm dropping those in now. Thanks.
All right, thank you so much, Karen. All right, we're on to question number 7. What is the status of Itsy implementation across the US and territories to date, and how do we track this progress? So let's go to Amanda for that one.
Hi, my name is Amanda Demain, and I'm an SLP as well. I'm working in a university hospital setting down in Miami. This is a great question, and our reference group, specifically the implementation advocacy team, is actually getting ready, little secret, to send out an environmental scan survey throughout the US. And this is really to better understand the status of Itsy implementation. This will be an anonymous survey, and it's going to be distributed through the next Itsy e-bite at the end of April. And then also we'll be posting these links on our social media pages as well as the Itsy website. If you do look at that Itsy website, you'll see under the American flag, because it has been updated as my other panelists here, my members have mentioned, that implementation is in progress across the US. And so I think in order for us to get a better feel or a temperature, this scan can really give us some information to identify trends of who's implementing, what point in the process they're in, how long it's taken, and then to see what the benefits were during that implementation process to be able to share that information, as well as the barriers. And identifying those barriers will help our US and territories reference groups, like all the members you've met today in these different specific streamlining areas, to really help you, the public and healthcare facility professionals, implement Itsy with the resources that you need without pushback. So that's our goal in regarding implementation. But anyone who is implementing, you see that email address has been put in the chat. You feel free to email our subgroup. I'm one of the co-leads for the implementation advocacy team.
All right, thank you so much, Amanda. We're on to question number 8, which is, I would like to implement IDDSI at my facility, but where do I start? Who needs to be involved? And how do I address challenges from the kitchen when they say they can't change or won't change their cooking methods? So let's go to Sarah for that one.
I unmute myself here. Hi, everybody. I'm Sarah Russell. I am a speech pathologist and I work at Michigan Medicine here in Ann Arbor, Michigan. And I work closely with Amanda as a team member on the implementation and advocacy subgroup. And I helped transition our hospital over to be fully IDDSI compliant back in 2018. So we have been implemented for a very long time. I can share some information about how us as a large university hospital transitioned over to IDDSI. But the best thing for everyone to do is to get very familiar with the IDDSI website, because there are so many resources available to you. You don't really have to reinvent the wheel. If you go to the resources tab, there are plenty of implementation guides depending on what kind of facility you work in. A speech pathologist and dietitians might be interested in the clinicians and healthcare providers tab that will give you a nice timeline for implementing IDDSI at your facility. Again, it's going to look different depending on what type of a place you are working in. Our suggestion really is to find an IDDSI champion at your facility. We had our director of patient food and nutrition services really spearhead and lead the way, but our team members included all the dietitians, speech pathologists. We had members of kitchen staff, the kitchen directors. We had some people from pharmacy and nursing. Depending on your facility, you may have more stakeholders or less. And it really depends on how quickly you want to move things along. Generally, I think it's going to take about a year. That's how long it took us here. We were very fortunate at this university hospital to have about 16 interns who were able to help us with mapping. And I realize not every facility is going to have all of those resources. So the size of your facility definitely will determine who all is on your team. And I want you to keep your eyes posted, just like Katrina was saying. Social media is going to be really invested in everything that you guys will all need to help with your implementation process. Take a look at LinkedIn, take a look at Instagram. We're going to have a lot of information about why it's important to transition over to IDDSI so you can get buy-in from all of the stakeholders in your facilities. And there was a second question about if the kitchen can't or won't change cooking methods to achieve more tender meats, more specifically, maybe for the level 7 easy to chew diet. I would say try and get together with sort of your multidisciplinary team. If there's a speech pathologist and a dietitian who could meet with someone in the kitchen to provide education to make sure everyone understands the benefit of providing some softer meats. Imagine trying to chew a certain piece of meat without any teeth. That might give the kitchen staff a little bit more information. But I would say if you're running into roadblocks, just be creative with your menu. And that's something that you can do together as a team. But there might be softer items that can add protein, like an egg salad or a chicken salad, that you can use instead of a tough piece of baked chicken or a piece of steak. So that's it. Back to you, Mary.
All right, thank you, Sarah. And I would just add, my employer is kind of in the midst of implementation of IDDSI solids. We found it was pretty straightforward to make the transition for liquids. So there's an opportunity to do it in sort of a stepwise fashion and make it happen that way. But definitely echo Sarah's comments about collaboration and identification of a champion. So great. All right, let's move on to question number 9. Is there a place or resource where individuals implementing Itsy can go to troubleshoot any issues that arise? So I'm going to turn that over to my colleague, Mary Rebicki.
I got to unmute. Hi, this is Mary Rebicki. I'm a dietitian working mostly in long-term care, and also am involved with helping to write the diet manual for the nutrition care manual. So I've been Itsy-ized for years and love it. And I wanted to answer kind of, we can spin off of what Sarah and Mary were saying is, okay, now you want to get going, you're starting, and then you run into troubles. And the same theme comes back. Number one, go back to the directions, right? If you get stuck on something, what do? Maybe I didn't read the directions right. Maybe there's something I can learn. Well, go back to the website. The website continues to have what you're going to need mostly to fix things. But also one of my new favorite things, I love what's new is on there. And also the, they focus on certain things. So like last October, they focused on a whole information sheet on purees and what to do. And what about these, pre-thickened or gelized type of products? How do we make those work? So don't forget to start at the basics, which is the website. Also on the website, the Itsy website, I love the YouTube videos. They're some of them are short, some are long, but that's a great place to go back when you're stuck and kind of look and say, well, how did they test it? Or what's it supposed to look like? Or, what can I do to move on forward and get through this? And the biggest thing to do is just keep going. Just keep going. Something's going to work out, and please share. So secondly, where are you going to reach out to is this group that's what we're all about today. That's what we've been doing for months. We really want to reach out and connect with people around the country that are getting through this, help each other out. Let us know what you're doing. Let us know what your problems are. And again, we can work through hopefully connecting and developing resources. That's what we're trying to do. We're going to develop resources, and we're going to develop any additional ways to help people with implementation. So I'm sure we'll all be talking soon.
Yeah. Mary, that's a great point about developing resources together. We had somebody had already asked us a question within our resources development work group. And the question was like, I need to develop competencies to show that my kitchen is, competent in making these purees and minced and moists and everything. And so we said, well, that's a great idea. We can take that on as a work group to develop competency lists. But in the meantime, we had the idea, we'll just use our audit tools. I have the audit tools link in the chat as well, but use the Itsy audit tools that are already there and turn those into competencies. And she was like, wow, that worked perfectly. Joint Commission loved it. And so there are some ideas that we can feed back and forth on each other to make new resources and new ideas. So great point. And I'll take it away with the next question too there, Mary.
Yeah, so we're going to turn it on to question 10. Are there resources for individuals and their caregivers dealing with swallowing difficulties in the community? So Karen, if you want to introduce yourself and answer that one.
Yeah, thanks. I'm Karen Scheffler and of swallowstudy.com, as well as I work in acute care. And I love how Mary Rebicki said, I'm Itsy-ized. It's Itsy-ized, I think you said. I've been Itsy-ized since 2014. I'm like so all in. So with caregivers, actually, we did actually on June, which is Dysphagia Awareness Month. Last year for June Dysphagia Awareness Month, the American Board of Swallowing and Swallowing Disorders did the whole month focusing on caring for the caregivers of people with dysphagia. So that's one plug there. But also we have this amazing Itsy app that you may or may not already know about. The Itsy app is free to download from any app store. It also functions without the use of Wi-Fi or your data. So if you're a home health therapist, for example, you just easily open it up on your iPad or your client's iPad, that kind of thing. So that's super handy. And then also referring to the website under resources, there's patient handouts, and those patient handouts really are also caregiver handouts. They are also, we're looking at those because as Mary Casper said in the beginning, Some of the words on the handouts are using words like crisps or piths, and these things that they love to talk about in England, but maybe not so much here. So we're actually working with a children's hospital here and trying to develop even more patient-friendly handouts, and making sure that the reading level is at a good reading level for a broad swoop of people across the nation. So Itsy app, patient resources, and keep checking out that website, because this is a living document. Everything is going to be adding to it and changing. So thanks.
All right. Thank you, Karen. Let's go on to question 11. Does Itsy offer training or educational webinars for SLPs and dietitians? That's gonna go over to Melissa to answer us.
Hi, everyone. Good afternoon. My name is Dr. Melissa Nyman, and by day, I am a medical affairs manager for the nutrition delivery portfolio at Cardinal Health. And by night, I am the co-chair of the Itsy Education and Training Committee. We do offer a whole series of different educational opportunities, including webinars. Itsy itself hosts our own webinars internally. So I just shared the link to register for our next opportunity, which is on April 12th at 1 p.m. Eastern, which will be focusing on transitioning to feeding and beyond for young children, expansion of food textures. We also actively promote educational opportunities with outside organizations. So for example, tomorrow, there will be a preparing for Itsy focusing on food services. And then on May 11th, Itsy Adoption is Coming, presented by Simply Thick. So please feel free to check all of those out. In addition, by following us socially on eBite, maybe I can ask Katrina to pull up her little icons again. I don't have any, but imagine me dancing with them. Again, following us through news tab on our newsletter. You can find us on Twitter, so Itsy at itsy.org, and then Instagram and LinkedIn. You'll be able to stay current on all of our educational learning opportunities. That includes webinars, a new series of PowerPoint presentations that we're developing to target different levels of competency related to food and nutrition services team members, creating new opportunities for education for family and care providers, dietitians and speech pathologists, and then doctors and nursing staff. We're also creating a snack room and pantry guide for the Itsy crosswalk for safe feeding after hours. So again, by participating in our social, you'll be able to stay up to date on all of these resources as they're launched. And we hope that when you interact with us, we'll find new resource gaps that exist and be able to address those as a community. Thanks.
All right, thank you so much, Melissa. That was great. Let's go on to the next question. When educating patients, staff, and caregivers, should we tell them the patient with dysphagia can eat foods in the level that are below their current recommended level? For example, would a patient on level 5, minced and moist, also eat purees such as pudding? So I'm gonna send that over to Cheryl to answer for us.
Hi, my name is Cheryl Itsy. I'm a registered dietitian nutritionist, and I am a partner in crime with Melissa on the Education and Training Committee. So first tactical question that we've got. Absolutely, you can educate your staff and family members that an individual can safely and successfully eat below their current recommended level up to pureed, but not including liquidized. Obviously, we don't want them eating above the recommended food level. And that said, those were just exclusive to the food side of the business, right? They may not drink soups, beverages, or nutritional supplements outside of the prescribed liquid level, neither higher nor lower. It's important that we keep these individuals who have dysphagia well-nourished and well-hydrated. So if that means that they love their pureed peaches, even though they're on an IDDSI level 6, soft and bite-sized, by all means, let them enjoy their pureed peaches. But conversely, we don't want to just offer pureed peaches and sliced cling peaches. We want to offer that full spectrum of the IDDSI levels, We want to offer the puree, the minced and moist, the soft and bite-sized, the easy to chew, and the regular. We want to offer all individuals the ability to eat and drink at their greatest and safest capacity. So that's our goal. Enjoy the food at your greatest level that you can and stay well hydrated and well nourished. So you can help us do that by suggesting on our media any gaps in resources that you need to do to safely do that. So great question. Thanks for asking it. And with that, I'm going to turn it over to Maggie.
All right, so we're on question 15, which is the testing methods for Itsy are vital to successful implementation. Can you briefly review the testing methods for liquids and foods? Can you explain which type of syringe is correct and why Itsy testing uses metal utensils? So as Cheryl mentioned, Maggie, it's yours to answer.
Hello, everybody. I'm Maggie Roach. I'm a registered dietitian and a little bit of an Itsy geek. I've been involved in Itsy in my practice for the last several years. And in particular, I do a lot of menu writing, recipe standardization. So I'll address some of the recipe questions and food questions as well. In terms of the testing methods, the first thing I'd like to say about that is the testing methods are the game changer when it comes to Itsy. This is really what's differentiating our ability to really make a difference when it comes to people with chewing and swallowing problems. By incorporating testing methods throughout our entire processes, for anyone who either prepares food, serves food, helps with feeding, etc., supports anyone eating with chewing and swallowing problems, the testing method empowers every person to validate that what we're serving is appropriate for what that individual has been determined by either physician or speech pathologist to be the appropriate consistency for them. That's the whole idea behind the testing methods. Now, this is a whole new concept for us. I like to say I've been a dietitian for over 30 years, and this is the biggest change in therapeutic diets I've seen in my entire practice. You know, maybe in the 90s, we went from exchange lists to carbohydrate counting, but this is a big deal. And so it is going to take change and transition and change management. So having said that about testing methods, I say that because it really empowers us to make a difference, both in safety and quality. Quality in terms of the foods we're serving and quality in terms of quality of life for those who are under our care. In terms of the specifics of the testing methods, Itsy.org already has wonderful resources for testing. The YouTube channel is great. There's wonderful for both liquids and foods. In terms of the syringe, there's a wonderful guide on Itsy.org on using a tape measure to make sure that the appropriate amount of centimeters are between the 0 and the 10 on the syringe. I've had a lot of luck doing that. And I've had a lot of luck finding syringes on Amazon, of all places. So, but I know that terror that you get, am I getting the right syringe? But they are out there, and all you need to do is get the tape measure to validate that your syringe size is correct. In terms of the metal utensils, the thing about the metal utensils that I like is that it gives you a little more leeway in terms of you can put a little more pressure. I believe the testing was done on metal spoons and forks, and the whole idea of the fork and the spoon is that pressure that we're using, for example, in minced and moist, lighter pressure, your thumbnail doesn't turn white, that mimics your tongue manipulating and pushing food around your mouth, particularly the roof of the mouth. So it mimics that in your mouth, and it demonstrates that, yes, this food is soft enough to break apart in the mouth, as opposed to diced, which is a heavier pressure. Our thumbnail can turn white because those who chew diced foods, soft and bite-sized, I should say, soft and bite-sized foods, that can hold a little bit more pressure. The spoon gives us that pressure approximation, the metal utensil. If you have a plastic fork or spoon, you can use them. They'll probably break easier, but I think they can be used. The ideal gold standard, of course, is the metal fork. My point is, let's just get going on the testing. You can start today. What I'd like to share with folks is test where you are. Even if you weren't going to change anything, everyone I'm sure on this call is serving purees right now. Get a fork, get a spoon, see where you are. Test your purees today. Once you become comfortable with the testing, it becomes a lot more easier to get into the specific food items that you're doing, and you see where you are, and you find the nuances of some of the adjustments that you need to make. And purees are a good question, a good place to start. I know we have one more question, Mary, before I get into some of the more the questions that we got on the chat about food.
Yeah, go ahead, Maggie. Let's look at question number 14, which is more specific. So level 5 minced and moist can be confusing to describe. Maggie, can you explain some of the key considerations for this food level? How should moisture like gravy or broth be added to achieve the appropriate consistency?
Okay, this is how I wrap my head around it, and I love that Itsy helped us focus on it this way. Minced and moist is basically a bolus of food. Think about what food looks like when you've masticated well. You've got basically minced, it's moist, it's soft, you can kind of manipulate it in your mouth, and if it's not soft, don't we feel that in our mouth anyway? So minced and moist is very similar to a chewed, well chewed, and moistened with saliva, think about that, bolus of food. And so that's what we're trying to mimic in what we're making. So I also think in terms of mashed, in my mind, that helps me. It's not, at first I thought it was like these perfectly minced pieces of food, as much as it's quasi, not quite pureed, well pulsed in a food processor for those of us who are in the food and nutrition end of things. It's not quite as pulsed or quite as pureed food. And so it may be inconsistent in size, but every single piece fits between, again, we got our tools, everybody on our team is going to know this, fits between the tines of a fork in width, and in length, it's no longer than the full 4 tines on the fork. And so if we can get people used to thinking about food in those terms, we will become more and more comfortable. In terms of the moisture, you know, before, again, back to what we're doing, many of us are doing now, we might have what we call textured modified or ground. And basically, we only think of the food in terms of being ground. And one of the other ways we can think about Itsy is that we talk and describe food with more definitions than we have up to this point. We have been talking about particle size, kind of, but not exactly. We've been talking about, you know, temperature, smell, but we haven't been talking about things like stickiness or softness or moisture. So we're going to expand our vocabulary and go through that process as well. So moisture, it is gravy, it's level 3. And that's easy to measure. You can measure level 3 with a syringe, but you can also measure 3 with a fork. So it's, your gravies are level 3 and it holds everything together and it's integrated as opposed to swimming on top. All right.
Thank you.
I know there's another question.
Yeah, we added some more questions. So let's just go to the next slide, which is question 15. So I'm going to jump into this one. Has anyone began work on how Itsy is incorporated into the health IT standards, whether it be the nutrition order FHIR resource and or working with the PACIO project, looking at doing with speech, language, hearing, swallowing, etc. I know that somebody on the panel was communicating about it. And so while I'm waiting for that person to unmute, and I got to go back up in my.
I can give a little bit of info on the EHR. I haven't done a ton of the EHR work myself. I had it easy when it came to us implementing Itsy. I was able to take our format and completely edit it. But I can tell you that my colleagues over at Hartford Healthcare instituted Itsy across 7 hospitals all at once. And they had one key person that worked with their EHR person. And this is a copy of the paperwork that they gave to their physicians and said, okay, you used to order this diet. Now in our EHR system, they use Epic specifically. That's what they translated from their previous diets to their new Itsy orders, was in their Epic system. And that one main person was the one that just from speech directly said, hey, this is what they're going to read now. And here's the form, and here's how you're going to order the diets. And I remember there was one little hitch because I know in the EHR system, I think they could only make changes on Wednesday nights. So the new diet orders had to take effect on a Thursday. So I think if I could give somebody any advice on making it work within those systems and making it work with IT, you really need a key person that's going to sit there and listen to what the challenges are from that IT side. And you need that IT person to understand in the clinical end too, why it's so important to facilitate the process and have that language read what we need it to read. And there are also IDDSI abbreviations. I don't know if anybody can pop those into the chat, but IDDSI does have color-coded abbreviations that can also be very useful. And I think in using your EHR systems as well as just communicating on a nursing spreadsheet what the person's diet is, just as a quick little side note.
Yeah, some of the tools, Katrina, that we've been using include not only having things prepared in my setting. We use providers like PCC or NetHealth for the rehab documentation, which was formerly Optima, and that IDDSI terminology has been incorporated into those, but it was a component of our rollout plan. All right, let's move on to the next question. Do you have actual menus, spreadsheets, recipes that you could share, specifically MM5 vegetables and sides that aren't pureed? And I think maybe Cheryl or Maggie might be able to answer that question about actual menus.
I'll take a stab at it. There are not specific menus that that IDDSI has put out, because of course everyone's menus are different. Your therapeutic diets match what's on your regular diet, and so depending on what your regular diet is, that's what your IDDSI levels would reflect. And so my suggestion is to start with your purees, your ready serving purees, and do your testing, test where you are now, and then tweak your recipes. That's all you'll need to do to get them to meet the IDDSI standards. From there, you will be surprised at the level of confidence that you will have, and then go to perhaps easy to chew, which is another one to tweak. I could tell you what you probably are going to need to do is adjust some of your meat recipes, your center of the plates, to be more moist cooking methods so that those foods fall apart more easily and minimize the amount of foods that you may have to grind to get them to be to a consistency that can be broken apart easily with the side of a fork. So it's really a process that you will go through in your organization, which I know sounds a little overwhelming right now, but I think if you stay focused on the fact that in the long run, this is going to immeasurably help with safety, and it does improve quality, because as you, and you're not doing this alone, your whole team then is involved because they're empowered to use the testing methods, and the culinarians on your team will be able to work with you to improve as you go. And if you just take it step by step, you do get there.
All right, thank you, Maggie.
Elaborate on that. Can you see my screen?
No.
No.
Okay. Can you see it now?
Getting there. Gotcha.
Okay. What are you looking at right now?
The IDDSI pyramids. Yep.
Okay. Hold on, that's the wrong screen. All right. Well, I cannot share my correct screen then, maybe. Can you see that?
Yes.
Okay. So this is what our menu looks like. And this is the coding behind the menu. But you can kind of see how we're starting to make that transition with our colleagues. Pureed is always going to be pureed. Then our mechanical ground, some people, we have kind of a mixed thing going on right now. Some people are on mechanical ground, some people have switched to the minced and moist. Some are on mechanical chopped, some have switched to the soft and bite-sized, and then the easy to chew. So basically, whether you're on NDD or IDDSI, you can put these dots next to whatever it is you're serving. So this might be scrambled eggs, pancake, French toast, and you can either put the dot there because it's available to pureed, or you can leave the dot off because, for example, it's not available to Easy to Chew. So that's just kind of how we're approaching it, is basically all of them are always available to pureed. Most of them are available to minced and moist and soft and bite size, and then some are available only exclusively to Easy to Chew. So it's an easy way for a patient to see what is available to them based on their diet.
Thank you, Cheryl. All right, I think we're going to do one more question here, and then we're going to wrap up. So, Peter, if you want to share that last question. So Itsy seems to be challenging when we consider resident preferences and liberalized diets to say that modified diets cannot have watermelon, cereal with milk, cucumbers, bread, etc. may affect resident satisfaction. Residents are going to be upset. It seems like each resident will have to be individualized, which will create huge issues on tray lines. And how would you tackle these issues? I'm going to throw in a start to an answer, which is that, you know, in my experience, we've actually used Itsy as a stepping stone to liberalize diets and to really examine closely the consistencies that people can handle and those that might pose more of a challenge to them. And so absolutely, Itsy allows you the framework to individualize diets. And yet at the same time, the framework also takes into account that there is variability in things like saliva production in an individual that are going to have an impact on their ability to manage a particular texture or food item. So we definitely have to be cognizant of the person who's receiving the food items and what their needs are, and yet try to avoid that super customization that sometimes happens on a tray line that runs us into problems. So I don't know if any of the other panelists have some comments on that question.
Yeah, I can make a mention there, Mary, as well. So, you know, for one thing, Dr. Steele likes to really reiterate the fact that Itsy is descriptive. It's not prescriptive. Itsy doesn't have just like a list of things. You're allowed to have this. You're not allowed to have that. We're not using that kind of language. We're describing foods, and now finally Itsy's given us ways that are based in evidence to actually test foods. So, you know, even just teaching somebody, you know, try this fork pressure test. You're having trouble with harder foods, so try this fork pressure test. And you can just teach it to somebody so easily. Like the Itsy's finally given us testing methods that are usable right at home. You know, the only thing you have to do is like send them home with a couple of syringes. Other than that, all the testing methods, we've got them on our fingers or chopsticks or our utensils. And it's just so easy to be able to educate the people that you work with now. Anybody else want to chime in?
Well, I think
to be continued, right?
Yeah,
to be continued.
That's
there's lots of
an
good, more
ongoing
juicy
question.
things. Yeah.
Yes.
Yeah. So as we wrap up here, our team contacts are listed here. There's usa.communications.education.bestpractices.data collection.advocacy and .resources at itsy.net. So it's all prefaced by the USA and then the names of the 6 different teams and at itsy.net. We know that we did not address everybody's questions that came in the Q&A. We're going to think about future town hall meetings, and we would welcome your communication with us in the future. We hope that you found this a valuable start to the conversation about what is happening in the United States and territories with regard to Itsy implementation. So thank you so much, panelists, for all of your great information and your volunteerism. Want to just remind people one more time, the Itsy app is available. The Itsy website is fully searchable, and we would welcome your questions. Look for us on social media, and we will look forward to another opportunity in the near future to get together again like this. Thank you so much. Thank you, Peter, for walking us through in the background, and we'll sign off now. Thank you very much. Bye.
Bye. Great job, Mary. Thanks, Peter.